long we have allowed drugs to ravage American homes, cities, and towns. We owe it to our children and to our country to do everything in our power to address this national shame and this human tragedy.
President Trump at the White House this afternoon declaring a national public health emergency over the opioid crisis. More than 140 Americans die every single day from drug overdoses. Now, we mentioned the president's declaration at the top of this newscast. The tri-state has been in the middle of that crisis now for quite a long time. It has strained resources of local police, fire departments, and medical professionals. Newtown Police Chief Tom Synan is in the middle of all of that. He, in fact, testified before Congress about the situation here in Hamilton County. He's on the Hamilton County Heroin Coalition. He's part of that. So thank you so much for being with us. I imagine you're really excited that this was declared today.
Thanks for having me, Tanya. No, I'm actually disappointed. There's been a lot of talk of an emergency. Now it's declared an emergency, but the action of an emergency is not behind it.
What do you mean exactly by that? The action? You're talking about dollars?
Need funding. I think it's great that it was declared a public health emergency because maybe that's the catalyst that shifts addiction out of the criminal justice system into the medical health system where it should be, where it can receive long-term care. But here's the thing. In this region, Cincinnati, Hamilton County, Claremont, Warren, Butler, Northern Kentucky, we have done a tremendous job of having all the right people, all the right places, all the right organizations together, and we're still dealing with this crisis because what we need is funding. We need peer navigators. We need infrastructure that can connect people quickly to treatment. We need more programs on the street. We know we have all the right answers. We just don't have the funding. And today
didn't give it?
Today didn't give it. It was a public health emergency, which is different than a national emergency. The national emergency would immediately release funding into the communities. What this does is it allows the grant money that's already out there to be separated. And we see hundreds of, like a few $100,000 in grant money, but we need millions.
You need millions. Do you have an estimate of how much you really need to not just address this issue, but to tackle it?
Yeah, so let me give you some perception with this. Back in 2015, we started a coalition. There was a study done. We needed about 12.5 million. That's when we were dealing with...
That's in 2015.
2015, we were dealing with 20 to 25 overdoses and 1 to 2 deaths a week. We now deal with 50 to 70 overdoses with 4 to 5 people dying every single week. And here's the thing. Tomorrow morning, we will wake up and what will happen is police officers, firefighters, nurses, doctors, families, advocates on the street trying to connect people will still deal with overdoses and deaths. This didn't do the job, and I'm disappointed. Hopefully it opens up a discussion. Hopefully Congress can do something, but I don't have a lot of faith that Congress is going to release a lot of money, the funding that we need.
You testified in front of the Senate, and what did you say?
Well,
primarily, in a nutshell.
Well, I told them basically that we were in crisis mode, and they knew that. And Senator Portman, it didn't matter if you were Republican or Democrat, they all came in. They knew this was a crisis and that it needed to be treated like a crisis.
And you are off this week to go testify again or meet with...
Yeah, I'll actually be speaking with President Clinton and Michael Bocelli, who is the former National Drug Policy, and we'll be down in Baltimore, Johns Hopkins University, which is releasing a white paper that day. So here's the thing. We in the country know what we need. The people on the street know what we need. The local government knows what they need. And what it all is it needs funding. We need more than just an emergency. I can sit there and talk about an emergency all day. We're in an emergency crisis. We need to fix that so that the long-term programs, whether it's prevention, treatment, or aftercare, can work. But right now we got to stop the bleeding. I asked a year ago for a tourniquet. Since that year, 5,000 overdose calls, 430 people have died.
Chief Synan, we need more than 2.5 minutes to talk about this for sure.
Absolutely.
Thank you so much for talking to us about this tonight.
Thanks, Tanya.